A very good afternoon, one and all, respected panelists, delegates, and a lovely intellectual audience I have here. I'm Dr. Ritu Singh, and I'm here for you, standing to present my talk on prospective study on effect of topical pilocarpine for the management of presbyopia. I have no financial relations or interest to disclose. Well, we all are aware that presbyopia is one of the most common causes of visual impairment in the latter half of the life, and it impairs daily near activities, and a meta-analysis postulates that it would affect more than 2 billion people in the coming end of this decade. So it's the need of the hour that we should provide spectacle freedom to this decade of the life. We have hallmark studies with pilocarpine hydrochloride 1.25% formulations with the names Gemini 1 and 2 study and Virgo study. Gemini study was the first FDA approved trial in 2021, and both these studies had financial interest with Allergan, Beauty, pilocarpine hydrochloride 1.25 was used in it. The difference was Gemini study used once daily dosing and Virgo study used 6-hour gap between the two doses. Our study is the first in the country to study pilocarpine nitrate 1% formulation, and the study duration was of 3 months in the last year, July 2024 to August 2024. Sorry, June 2024 to August 2024. It's a tertiary center, hospital-based prospective cohort analysis, and we have a tree map on the right-hand side, which showed the patient profile demographics of my included patients. Most of the patients were of desk job or IT professionals, followed by homemakers and other miscellaneous profile. So it's important that most patients had myopic, I have not included in my slides, but they have the myopic profile. Therefore, they would come up saying that ab chashma nahi laga ke hum log kaam kar sakte. They would often remove their specs, and this was the chief complaint that they had, continuously removing their myopic glasses to look at the screens. And 43% of the chunk is a major significant presentation. Phakic patients aged above 40 years with chief complaints of diminished near vision were included, and patients who had known pilocarpine allergy, uveitis, or any history of ocular surgery or concomitant systemic morbidity were excluded. All the patients were given a list of potential side effects and were only included after taking the informed consent. We had a total of 153 patients recruited in the study with an almost equal gender profile. And these were the outcome measures: best corrected visual acuity on logMAR, near vision as on Jaggers chart, anterior segment examination on slit lamp, and posterior segment examination on indirect ophthalmoscopy to rule out any high myope, because pilocarpine has a side effect of retinal detachment noted in a previous review of literature. One thing to note was nearly 1/3 of the patients who were recruited, they discontinued the use of drug after 2 weeks. They were asked to continue for 2 months, but they stopped in between due to brow ache and hyperemia. Due to time constraint and the slide limit, I have included 2 slides for my results. Herein, you can see that the improvement from baseline at 2 weeks was less than 0.05 with a confidence interval of 95%. The baseline of all patients was 15.32 near vision, and it improved to 7.69 after 2 weeks and 7.37 after 1 month. Therefore, the patients had a significant near vision despite discontinuing the drop after 2 weeks. So presbyopia is a universal age-related visual impairment, and there is no association with gender, education, or socioeconomic status, as seen with different studies as well, such as Gemini and Virgo study. We have various concentration formulations, but this was the first with pilocarpine nitrate. Patients in our study, they displayed both objective and subjective satisfaction, and the side effects majorly were brow ache and headache. Nearly 54 patients out of 153 reported that. So spectacle independence is not a choice for all, not young alone, because we all keep talking about LASIK and ICL, but it's also for presbyopes. We should give them a choice to have the spectacle freedom. Topical pilocarpine drop is a promising drug. It is cheap and safe alternative to near glasses, and early onset benefit with negligible side effects as noted in the previous slides. And this was a tagline I told my friends, that if you have trouble using your Nokia, say bye-bye to presbyopia. Thank you so much.
So 1/3 of patients stopped using because
Yes,
of
sir, they
headache
did.
and brow ache.
Yes, sir. Majority of them were females.
Not this a huge number.
It is. So 1/3 is a huge number, but on further motivation, they would use it, sir. But we did not include it in statistical analysis.
In spite of their headache and brow ache, they start using.
We used a visual analog scale to see the subjective satisfaction score, and majority of them had ranked it 6 out of 10. So
It's all depend upon the motivation he
and
or
the
she is
mindset of
having.
the patients as
I
well.
disagree on that.
We
I
regularly prescribe
Sorry, sir?
after the study.
So we are still, and it's in the pipeline to get it published as well, because pilocarpine nitrate hasn't been denoted anywhere, sir. We also had mesopic pupil examination, but did not put any statistical analysis because one third of the patients were dropped out within
How
2
much
weeks.
long-term study?
So yes, sir.
Anyone long-term kitna
So
lamba time? How much long-term study?
no, none of them less than 40. And sir, the time limit was, the pressures were not included in the statistical analysis, but none of them had glaucoma. We ruled out any concomitant ocular disease or surgery, any past history. But sir, the yes, sir.
Long-term uses on UV
So
attractor.
we only performed the statistical
yes.
analysis only till December, sir. We
Okay.
stopped it after December, sir.
You must have studied earlier studies also.
There are studies,
So
yes, sir.
is there any effects on pigments and like that?
So not pigments, but definitely on the pupil size. Significant pupil diameter has been seen. It do reduce.
Contrast,
And the depth of
contrast.
focus. Contrast has been studied, not significant, ma'am. Pupillary size has been significantly reported, both in Gemini and Virgo trials also. They say that is the reason why the depth of focus is great. Another thing that they've mentioned is high myopes won't do any advantage here because they will have a further myopic shift. It just adds on to their problem. But low myopes, less than 1 or 1.5 diopter can do that because the major chief complaint the IT professionals came up with was, "Sahab, hum use kare 1 diopter and nikalna pad raha baar." So they were the most happiest, followed by homemakers, and the rest of them were tailors or
So only a selected area.
Yes, sir.
But
33%
yeah,
always reduced, rest of these reduced. Oh, I think only 1/3 patients
Only 1/3, sir. Yes, sir.
they will use.
yeah, because it's not a very
Also
easy thing to
conjunctival-
adapt to pilocarpine.
It is.
If you try it once, you'll know how much the headache,
begins,
the
yes.
nauseousness, and all that
The
thing
T
you
half
get.
of it was just 6 hours. We would get phone calls from patient
Yeah,
that there is
yeah,
a slight broic,
yeah,
but
yeah.
they were motivated enough to use it further. And mostly the females were the ones who complained.
If
That
we
was- yes,
motivate
sir.
them, I don't think they will start using. If they themselves keep motivating that I'm not supposed to use glasses, then
Only
this
people who
criteria
have
may
long
ask
Yeah,
them.
yeah.
hours
It's
of screen
headache.
time.
It's headache versus their motivation. So if you will see whatever is more important, that's where they will take the advantage of the situation. Yeah.
Of course. Thank you so
Thank
much.
you.
Thank you, ma'am.
Thank you.